I want to pay my respects to the Gadigal people of the Eora Nation on whose land we are meeting. Tonight, calls for a humanitarian pause to the Israel-Gaza war grow louder as aid agencies struggle to get help to those most in need. And Australia's vaping crisis. Is it too late to kick the habit? Joining our panel, Guardian Australia journalist Matilda Boseley. Her book, The Year I Met My Brain, is about being diagnosed with ADHD at the age of 23. Health and Aged Care Minister Mark Butler, the Labor member for Hindmarsh. Executive Director of Médecins on Frontières Australia, Jennifer Tierney, who's worked in South Sudan and Lebanon. Liberal member for Menzies, Keith Wolahan, a lawyer and former Australian Army captain. And independent member for Fowler, Lee, the first Vietnamese Australian MP in federal parliament. Also tonight, the push to make ADHD diagnosis more accessible. Welcome to Q&A. Hello, I'm Patricia Carvelis. Remember, you can live stream us around the country on iView and all the socials. Quandra is the hashtag. Please get involved. Before we get started tonight, we'll bring you the topic of our online poll. We're asking you, should alcohol have graphic warning labels similar to cigarettes? You can cast your votes anonymously on the Q&A Facebook and YouTube accounts or the ABC News X and Instagram accounts. We'll bring you the results a little later. To begin tonight's discussion, here's a question from Margaret Weiss.
How does Israel's reaction to the Hamas attack on the 7th of October compare to the US reaction to 9/11 when the US, UK, Australia and other democratic nations entered into a 20-year war against the Taliban in Afghanistan with many civilian casualties?
Thanks, Margaret. I might start with you, Keith.
No, thank you for that question, Margot. I think it's a really important question. There are many comparisons and there are many lessons, and I think that the world owes itself the opportunity to learn from those lessons, and Australia certainly did. The comparisons are that both involved a massive intelligence failure, both involved the deliberate attack of civilians, and the deliberate attack was designed to traumatise a nation. And like September 11 is a mark in the United States calendar, there's a before and there's an after. In Israel, the 7th of October will have a before and an after. Now, there are many, many lessons to learn. And some of them I think we should consider are that goodwill fades. And I've noticed that for Israel, that goodwill has faded quicker than it did for the United States. And we have to ask ourselves why. And I know many Israelis are asking themselves why. We also have to make sure that tactical victories don't undermine your strategic objective. And the decisions that Israel will make now will reverberate through this conflict to the point where it will end. And there's two ways you can approach what happened. One is the lesson from Al-Qaeda. And the United States was quite successful in dealing with Al-Qaeda. The other is an occupation and a counterinsurgency with the Taliban. And that was a huge part of my life. I did 3 tours there. That ended in a failure. It handed the country back to the Taliban. So I think there are lessons to learn there, and there are certainly lessons in the issue of war crimes, and I'm happy to discuss that further.
Well, you've just gone to war crimes, so I'm going to ask you, because many people say what they're seeing now, for instance, the refugee camp, are war crimes. Do you see them that way?
I don't, and I know that's a distasteful answer to hear from many people, that they don't want to hear that, because when you see civilians killed, of course, your heart just aches for the tragedy, the human tragedy that's occurred.
There are over 9,000 now, and many of them children.
And look, even if it was just a fraction of that's still a tragedy. So one of the many lessons from Afghanistan and Iraq is that there's a moral, legal and strategic reason why you should avoid civilian casualties. Israel knows that. This does not assist Israel to have civilians killed, not at all. Now, the laws of war involved a concept called proportionality. It's a distasteful concept to say out loud, but it doesn't mean that the mere fact of civilians being killed is evidence of a war crime. It means that you have to assess and balance the military objective that you're trying to achieve and whether that is proportionate to the civilian casualties, even if they are unintended.
But we're talking about a situation where there's one or very few targets with potentially many hundreds of casualties. Does that reflect that proportionality in your mind still? Like, where does that line end?
I want to bring in Jennifer if I can. I'd just want to hear a few more voices before we do cross-examine you, Keith, which I'm looking forward to too. Don't worry, Matilda. But what do you think in relation to that question? Are there lessons and that question around war crimes?
I mean, I think the humanitarian impact of what's happening in Gaza right now and what we've seen by virtue of the war on terror in Afghanistan, for instance, are horrifying. And in both contexts, we see that the civilian population is suffering in ways that I don't know that any of us can really tolerate. And when we talk about proportionality and international humanitarian law and all of the definitions and splitting the hairs over whether or not a target was appropriate, we are talking about 4,000 children who are dead. And if I may be very clear, those are the most unpleasant deaths that these children could have died. They're being crushed in their homes, they're losing their limbs, they're undergoing surgery without anesthetics. What we are witnessing is horrifying, no matter the definition, and it should shock the conscience of all of us.
Darlene.
I think it's a product of a war in Vietnam, the horror of wars. And I think, we can sit here and agree with Jennifer and analyse and have, this critical and have this definition. War really is about a massacre of people who don't know one another, by people, over profit by people who know one another and they don't massacre each other. And that's from a poet, Paul Valery. And as somebody who know the impact of wars on families, on women and children and the innocent lives, I think it's very hard to sit there and watch what we see on our screens and what we hear and what we read and the devastation and it's just, for me, it just brings back this idea that as a society, Australia, we have to really stand to bring we're such a multicultural society, we have to stand for cohesion. We can't really stand by and just watch innocent lives being lost, and children in particular.
Do you think there should be a ceasefire?
I absolutely think there should be a ceasefire. I think that it's just, there's no just, for me, yes, Hamas, what Hamas did, on October the 7th, it should be condemned and has been condemned. But you cannot right a wrong with more wrongs. And I think there has to be a point where we think, well, when is this going to stop? There has to be some sanity in this. It's just, we just have to stop it.
Well, on that question that our questioner asked in relation to repeating the mistakes, Mark Butler, is that something you fear?
Well, I mean, when President Biden went to Israel, he made this point to Prime Minister Netanyahu. He said that, I think his advice was that Israel not become consumed with their rage, their understandable rage at what happened on October 7, that they not be consumed by it, and said that the US, in its response to 9/11, had made mistakes, were his words. And I think that goes back to what governments across the world have been saying to Israel very forcefully, that yes, you have a right to defend yourself against attacks like the one you experienced on the 7th of October, but the way in which you do it is critically important.
OK, well, on that, Penny Wong said that how many civilian deaths in Gaza essentially would be considered too many. These ongoing civilian deaths would be considered too many. We're about 10,000 Palestinians dead, pretty much. Is that too many?
Well, this is an awful arithmetic to get into. This is an extremely difficult situation. You don't have two armies marching out to face each other on the plains with no civilians around. You have a situation where Israel is responding to an attack from Hamas, and Hamas has deliberately burrowed itself behind civilians and civilian infrastructure. I mean, what countries, now including the US, have called upon, including our own government, is for there to be a pause in hostilities.
What is a pause, though? What is a pause?
Well, a pause is different to a ceasefire,
yes,
in the sense that a ceasefire usually involves the cessation of hostilities while a final settlement is being reached, while a final settlement is being negotiated that will see the complete cessation of hostilities. Now, Israel and Hamas are not at that point.
No.
I don't think anyone would suggest they are. So what people are calling for is for actions, the bombing, the intervention to stop so that organisations like Jennifer's and many others besides can get food in, can get water in, fuel, most importantly, medical supplies, doctors from organisations like MSF. That has been the call from our government now for a couple of weeks and over the last few days from the US as well.
But can I make the distinction between a humanitarian pause and a ceasefire? You know, we are doctors in our nature, and what you are asking us to do with a humanitarian pause is to bring in the equipment necessary to stitch people up and repair them, and then to start the bombing again, and for us to then fix them. That is not enough. We need a ceasefire. I mean, what we are seeing right now is dozens and dozens of medical facilities in Gaza, which are absolutely razed to the ground. There is no capacity in Gaza at this point to care for the wounded who are there already. There are 3,500 beds in Gaza. Most of them are not available to patients at this point, and there are 10,000 plus wounded. Our surgeons are literally doing surgery on people on the ground, outside, in tents, in open air. There is no capacity at this point for a pause. We have to stop and allow the system to be able to rebuild, to be able to provide care. And I just want to say one thing. I'm an American. I was there on 9/11, and I feel so deeply for the rage and the horror that the Israeli people must be feeling right now over what has happened to them. But I also know that when I look back at how angry my father and I were sitting there, I wouldn't do it the same. I wouldn't do it the same. So please, let calmer heads prevail right now and allow the people of Palestine to receive the care that they need.
Okay. Next, we'll go to a question from Patrick Versace.
My question? Yes. Jennifer, I guess my question really is to you. MSF clearly is an amazing organisation. You know, it delivers care to people in horrible situations. And you think Gaza and Afghanistan, Myanmar. But there seems to be a problem where MSF in the end finds itself in places where the regime does not share our values of humanity, of common dignity and caring for people. And so my question really is, how does MSF, with its boards of governance, balance this tension that exists between providing care for people who otherwise would have no care, but then risking indirectly enabling corrupt and bad, wicked regimes? In the end, you have a lot of financial donors. You know, the Australia-New Zealand branch of MSF gets $100 million a year in donations. And as a donor, I think I'd be horrified to think that $1 of my money ended up in the pocket of an Hamas leader or Taliban fighter or one of the military junta in Myanmar.
Jennifer?
So we are a $100 million organization, and I can't thank the supporters enough for sticking with us through all of the atrocities that have happened over the last years. And we are a neutral organization. And what that means is when negotiating access to civilians who are being harmed in a conflict, or anyone who's being harmed in a conflict, we will talk to all sides of a conflict, no matter how distasteful those sides may be perceived to be by outside parties. We are also a medical organization, and here in Sydney, the first thing that someone says in an emergency room isn't to, find out whether or not someone's committed a crime, hurt someone, or whether they're in a gang when they have a critical injury. So we will stitch up whoever comes to our hospital because that is what medical ethics are about. It puts us in a difficult position at times, that is absolutely true, but those are the values on which we stand.
Keith, obviously, channeling aid to aid organisations and where it goes is contentious, as is clear from the question. But do you think it's satisfactory as an answer in terms of the way that these organisations have to plan these things?
It's an important question because when we look at the domains of war, traditionally it was land and sea, then we had air, now we've got cyber and space. But a key domain of war is information, and there's an information war happening around the world. And organisations like MSF, who do fantastic work and are really needed here, there's got to be careful they don't play into that information war. And an example happens here right now, which is when you say there should be a ceasefire, that is a euphemism for whether Israel has a right to exist. Because if Israel has a right to exist, then it has a right to defend itself. And any nation who had an attack like that must react, must eliminate Hamas. There's nothing else that's acceptable.
Just want to challenge you on that. Calling for a ceasefire isn't contesting Israel's right to exist, is it?
It is, because
but
you have to say...
But it's not for many people who are articulating it. Because there are Jewish people articulating it.
Of course.
And they want Israel to exist.
Of course. That's not the intent of everyone.
They're not calling for Israel to be abolished. They're saying they want a ceasefire to end the death.
But for some, it is. For some, it is, because you have to ask the counterfactual. Because if you say there's a ceasefire, well, how long will that last? And a ceasefire, you've made the distinction between a pause and a ceasefire, so there's an implication it's permanent. What does Israel get to do to defend itself after that attack? And I ask, if that attack occurred in Egypt or Syria or Lebanon, and can you just imagine the reaction? No state, Australia wouldn't sit by and do nothing. Israel is entitled to defend itself. It has an obligation to defend itself.
Matilda?
I mean, I guess I would... If we're taking things through and saying, OK, if we do this, what are the consequences? What are the consequences if we see Israel enact its entire plan? Disassemble Hamas, destroy its capacity. What then? I mean, it's not like the entire idea of Hamas is going to have disappeared. It's not like, you know, we know that organisations like this, it's, you know, cut off one head, 3 more grow. There's a question about when we get to the end of this, even if there isn't a ceasefire, even if Israel is utterly successful, are we going to have left this region at all in a state where it is able to self-govern anyway? It's not clear to me that it's one or the other. You continue and it's total success, or you have a ceasefire and then everything collapses.
Di?
Look, I think I was listening to Keith, and I think, of course, you know, Israel has the right to defend itself. I don't think anybody questioned that. I think the ceasefire is about giving that space to, because to look at the whole human, you know, human impact into killings, and to find a way to really allow aid to get in, allow, you know, people to be, if people can be saved, or children can be saved. Because if we look at the destruction, if we look at what's happening at the moment in Gaza, you know, I'm not there on the ground, and no one is on the ground there. But what we see on television, and hopefully you think, oh my God, how true is this? The devastation. Like, if there's no ceasefire, are we eliminating a whole population there? Is that what Israel? And I'm sure Israel would not want that to happen. What we're seeing is, are we moving towards eliminating that whole group of people there?
Di, how big an issue is this in your electorate?
Look, I've had over 200, you know, probably every day I'll get an email from local constituents, you know, people in my electorate calling, asking the government, our government, to really ask for a ceasefire. And, you know, it is impacting, you know, a large proportion of the people in Fowler. People from diverse backgrounds, so it's not any particular ethnic group, but diverse backgrounds who are seeing, especially I think there are a lot of Vietnamese names, and I think they have seen wars, they've seen the impact of war, so they're asking, please speak up and ask for a ceasefire. And so I think until you've been through a war, you've lived through a war, you really don't know why, for people like myself, we're calling for a ceasefire.
Mark Butler, can you imagine your government calling for a ceasefire? Is there a tipping point?
Well, I think there would have to be the prospect of a settlement between the two parties. And I mean, I think to a degree we're getting into semantics here. What I think everyone is calling for, including the Americans now, is for hostilities to cease or pause while there's a flow of humanitarian supplies into Gaza. No one said exactly how long it would be. I think everyone agrees, though. I think Israel hasn't got to this position, but everyone from outside, I think, reasonably agrees we need to pause this to allow supplies to enter. But I think the idea that Israel and Hamas are going to come to a settlement anytime soon is a fantasy. And I think Penny Wong outlined over the weekend our government's views about the longer game here, because to Matilda's point, I mean, at some point people have to turn their minds to what happens next. And I think from our point of view, the dismantling of Hamas, which is a terrorist organisation listed by our government, is a precondition to peace there, but that means that we're going to have to see a different type of administration in the Palestinian territories, a reformed, peaceful Palestinian Authority that will have to involve support from other Arab governments around the region. There's going to have to be huge international investment in economic development in those territories. We've seen in Ireland the benefit of that to deliver a lasting peace. And as Penny said also in her article, Israel has to stop building more settlements in the occupied Palestinian territories if we really are going to have a prospect of a two-state solution. Now, I think that solution is further out of reach than any time I can remember, but we have to keep our eye on that as the ultimate objective.
Now I'd like to bring in JD Namasasa.
Excellent. Good evening. In the same breath as the IMF recommendation for the RBA to lift interest rates, we saw Anthony Albanese do multiple trips overseas, including the recent trip to China. Does the Albanese government see improved foreign relation as having the capacity to improving the plight of Australians on the domestic front?
Done.
Well,
The Prime Minister spending a lot of time overseas. Is that trying to help our domestic situation? That's the question.
Right.
Yeah.
Right. There's an obvious cost of living crisis, but we've seen sections of the media accusing Albo of being Airbus Albo.
So basically the critique is that he's spending too much time overseas, but are those trips useful to our economic conditions?
Yes.
Diley, quick answer on that.
Oh, gosh, I think Prime Ministers do travel all the time overseas. I think that's a role of a Prime Minister. I think that, this should be Mark Butler's answer, but from my perspective as an independent MP, I hope what he's trying to do and what he's doing, the meetings that he's having across the world, will bring some economic, benefits to our country. We are experiencing huge cost of living crisis, but I think in order to deal with the cost of living crisis that we're all experiencing, especially in Western Sydney, from my perspective, is that we have to address some of the policies that we have locally in our country. Okay.
Keith, I want to bring you in right now. The Prime Minister, Anthony Albanese, is meeting with Chinese President Xi Jinping. It's a really historic moment. After 7 years, the first time an Australian Prime Minister is doing that. So this is one of his trips. Obviously, one of the reasons, as you know, Keith, that Australia is there is to stabilise the relationship, but also to get rid of those last trade sanctions as well, which would have an economic benefit to our country. So do you see a great benefit there? Because there's been a lot of criteria that the coalition's been building around this trip.
There is. Look, I think we are a trading nation and still, despite the tensions, we have enormous trade with China. So we welcome the Prime Minister's trip to China. But it's important that he goes there and he's having those meetings now, that he has tough conversations. Because up until many years ago, we could always separate our view on economics and trade and national security. We could be more liberal on one and more realist on the other. But the CCP didn't see it that way, and we saw trade weaponised against us. So we welcome the thawing of that, but we should keep that in mind when we're looking at other trade agreements, like we've got the Pacific Trade Agreement, the CPTT. It's a very long acronym.
But are you happy to see Anthony Albanese travelling lots?
If he's going for... I'm not going to criticise the Prime Minister
Some of your
for
colleagues
acting out of interest. And they're welcome to do that.
But you're not?
Well, no, I'm not. I'm not going to criticise him for acting in our interest. We are a middle power that has a role to play in the world, and he is our representative. Now, if he's distracted from other things, that's for him to decide his diary. But if there's a key event for him to go to, I'm glad that he's there representing us.
OK. This trip is pretty important, Mark Butler.
It's just extraordinary. Keith's Deputy Leader, Susan Lee, on Thursday was complaining about the Prime Minister being out of the country. He wasn't. Peter Dutton was the one out of the country at this sort of rather curious right-wing conference.
Well, they're currently both out of the country.
Now they're both out of the country.
Peter Dutton wasn't
and Prime Minister Albanese is up meeting with Xi. There were $20 billion worth of trade sanctions put on Australia by China. $19.5 billion of those have been resolved from hard work from our ministers, particularly Penny Wong and Don Farrell, but also the Prime Minister. We're very hopeful that in time we'll be able to resolve the outstanding, the lobster and the beef, the surf and the turf, the reef and the beef. And we're very hopeful that we can do that. This is important for jobs. This is important for our economy. This is our biggest trading partner. You know, we now have the largest trade surplus with China of any nation on the planet. Like, being up there, it's a difficult relationship, it's challenging, but being up there, being open with them, trying to stabilise it, cooperating where we can and disagreeing where we must.
And how loud will the disagreement be? Will the Prime Minister be loud about the human rights abuses, Xinjiang, we know them, the Australian being detained?
The Prime Minister has been very clear on that, and patient work by particularly Penny Wong led to the release of Cheng Lei. We'll be up there advocating the interests of Dr Young. We're worried about his medical circumstances now, but the Prime Minister's made it clear, as has Penny Wong, that we'll be advocating his interests as well.
And on the South China Sea?
We've said very clearly that we are going to advocate our national interests and the regional interests, and we will disagree where we must, but we also recognise this is an important relationship, and it required, when we came to government, some patient, deliberative work, particularly to restore stability to that trading relationship. And I think the fact we've been able to restore 95% of those trade sanctions is very important for our economy.
Okay. If you're just joining us, you're watching Q&A Live with Matilda, Boseley, Mark Butler, Jennifer, Tierney, Keith Wolahan and Di Lee. Plenty to get to tonight, but here's a video question from Rachel Allen.
This is a question for the Health Minister, Mark Butler. My son Dylan died of alcohol-induced liver disease in April 2022. He was only 26 at the time. And when he was in hospital, at one point he knew he wasn't going to survive. And he stressed to me how important it was that alcohol had warning labels. He felt strongly that by doing this, people, especially young people, could make a more informed decision about their health due to the high risks associated with drinking alcohol, particularly cheap, high-volume wine casks. My question to you, Mark Butler, is, will you consider making the necessary changes to alcohol labelling in the near future so there is more potential to save lives?
Mark.
Well, thank you to Rachel's question. I'm just so sorry for her loss. It must be an enormous source of grief to lose a son that young. And we know many of us have been touched by the risky use of alcohol. It causes a great deal of injury and it causes a great deal of disease in our community. It's long been the job of governments of both political persuasions to encourage and advise the community on the responsible use of alcohol, and frankly to put in services for people where they are addicted or are using alcohol in a risky and unhealthy way. I think, though, some compare this to what we've done in smoking, and there is a significant difference there. We went very hard on labelling and packaging of smoking when we were last in government because the advice is there is no safe use of tobacco. The vast bulk of Australians engage in the use of alcohol in a responsible, moderate way, and that's as it should be. It's a significant part of our culture. It's not the same in cigarettes. You know, what we wanted to do was to send a very clear message that cigarettes should go completely once and for all, particularly to young people. We did the same when I was in the health portfolio 12 years ago around labelling of alcohol for pregnant women, because there is no safe use of alcohol when you are pregnant. It's quite different, though, when we're talking about the general use of alcohol. We will continue to do what we can to encourage and advise Australians.
Have you received advice from your department about whether these labels would be useful?
No, I haven't.
Have you asked for it?
No, I haven't.
Why not?
The Assistant Minister has asked for advice on what's happening around the country. I'll be very clear. Our energy right now is on reigniting the fight against tobacco. For 10 years, we haven't seen any further work than we did when we were last in government.
To that.
We've got legislation.
So you're not going to do it? No alcohol?
That's not on our agenda right now. We've made the labelling of drinking, of labels around the use of alcohol when pregnant mandatory. That's come into effect now, which is a good thing, but there is no current plan to change the labelling of alcohol.
Okay. Matilda, do you think it would be useful?
I mean, the data that we have at the moment is very limited. We know that warning labels, when they're anything less than the extremely graphic and confronting warning labels that we see on cigarettes, do increase awareness, but not necessarily, we don't have the data yet to see whether they actually change behaviour. So I think there's a question about, would we have to go to the extreme? If we were going to implement this in an effective way, would it have to be that extreme? And that would come at a cultural cost. You know, it wouldn't be the aesthetics, I think, of drinking. And for a lot of people, that might be very much worth it. But I think that's a larger conversation about whether that cultural cost of alcohol as a cultural artefact within Australia would be worth it for something that we aren't 100% sure about the effectiveness as of yet.
Okay. Our next question is from Ben Kyoko.
I've been diagnosed with ADHD and ASD. As I'm under 25, my ASD diagnosis was covered by Medicare. For ADHD, there is no such Medicare allowance for diagnosis that allows Australians to obtain the benefits of treatment and support. Minister, what is your plan to make a diagnosis accessible for more Australians under Medicare?
It's a question for the Minister, and I'm going to put it to the Minister, but I will start with Matilda because her entire book is about getting diagnosed, the whole process. I think she's our expert. Matilda, you know there's a report out today and you've heard the question. What needs to happen?
A massive increase in Medicare benefits towards ADHD treatment. Truly, we have the Senate inquiry report out, and what we're seeing is that a lot of people, not only are there not enough practitioners around to diagnose this, people who are, when you're an adult, you need to be diagnosed by a psychiatrist if you want to access stimulant medication, which is the most effective form of medication for ADHD. We're currently seeing wait lists of 13, 14 months, and that's extraordinarily dangerous for those people during that time. And when you do access it, it's often through the private sector. It's often running people into the thousands of dollars, into the 4 digits at the very least. And I've spoken to so many people who have said, I reckon this is probably what I've got. I think I'm almost certain of it. I've looked at all. It is just not within my capacity to get diagnosed at this point. It's just out of reach, and I think that's truly unacceptable.
Was that similar for you, Ben? It was a difficult process to get diagnosed?
Look, I mean, this guy, he was, we through it. So, but yeah, I mean, it really, consisted of going to this regular psychologist appointment, which obviously have, those own costs, and then, getting the referral from GPs. That, Medicare can help with that. But I think now we've also seen that issue with bulk billing too. So, yeah.
And also the recurring costs. You need to go back to either the psychiatrist or your GP if you're lucky enough to be referred every 6 months. There's constant mental health care plans on top of that, therapy on top of that. It's extraordinarily expensive to have ADHD, and it should not be, because it's a group of people that are already economically disadvantaged.
All right, Minister.
My turn?
It's so your turn, because you got the power on this one.
Yeah.
What are you going to do?
Well, this Senate inquiry that Matilda's been a part of, I'm sure, and lots of others, it's had a huge response in the community. Has delivered its report tonight. I haven't had the chance to read it in the last 2 hours.
I've read the executive summary. I can help you.
Look, this is an area that's seen a very significant lift in diagnosis rates. We've seen about a doubling of prescriptions for medicines for this condition over the last 10 years. And that broadly, I think, is a good thing, because I think there's a much greater level of awareness and understanding of this condition. That's a global phenomenon. I mean, the diagnosis of it has changed quite significantly in the last 10 years, but it is leading to a bottleneck. And this is not just around ADHD. There is a very significant supply issue around psychiatry generally, and that's having impacts right across mental health, including at the very severe end when people are being discharged from hospital, maybe having been sectioned. There's a very significant difficulty in getting access to a consultant psychiatrist. So these workforce supply issues are much more systemic than just around ADHD. But I think many parts of the health sector are now only really learning how to treat and care and support people who have been diagnosed. We've last month promulgated new clinical guidelines that have been endorsed by the National Health and Medical Research Council. I think that will lift the understanding of health professionals generally, not just psychiatrists.
There's been some pushback from medical professionals that you've seen saying there's an overdiagnosis. Yeah. Do you subscribe to that view?
No, I don't. I've seen that a little bit over the last several days, and that's not uncommon in the mental health space. These are not things you can take a blood test for. So, you know, often in the health sector, in mental health, there is a bit of contestability between practitioners about the extent of diagnosis and such like. I hope that the Senate inquiry will have teased some of those issues out. But I think it's been terrific to see just the level of understanding and awareness increase over the last several years. The contribution that Matilda and others have made to that's been really valuable, and I'm looking forward to considering the recommendations of the Senate inquiry.
And Matilda, you noticed because you're on TikTok, right?
Yeah.
I love that story. Many people would not have heard it.
No, yes, it is somewhat my greatest shame, but also an extraordinarily common story, which is that during the pandemic, I started using TikTok unhealthy amount, I'd say. Saw a couple of videos talking about, here's symptoms for ADHD in adult women, and if it was the first time it occurred to me that adult women could have it, and then suddenly it was like someone was reading my own soul back out to me, and eventually it got to the point where I was like, it's a bit too spooky, have to go get diagnosed. And we're seeing that. Like, that is, we had COVID, it broke down everyone's sense of normalcy, it broke down all the structures people had to support themselves. It's not surprising that at the same time that we have a short-form video app, something the ADHD brain loves, and
best thing ever.
It's tailor-made, unfortunately, for me, that we have this huge awareness. We've got a place to disseminate the information and a bunch of people who are realising they're struggling in a way that they haven't before. Just on when it's talked about the worries about overdiagnosis, I would just point out we currently know there's about 400,000 people receiving ADHD prescriptions. It's about 5.8% of the population. That's 1.4 million. So we're still missing 1 million. So I wouldn't be too freaking out about the overdiagnosis just yet.
Just yet. Keith, is this something that comes up? I mean, I know many parents are concerned that there's not enough support.
It does. It comes up more as a parent than as a politician. But like you, Mark, I saw the Senate report. It's almost 400 pages. And then I saw your book and I thought, I quickly scanned the executive summary, but your book is fantastic. And I just...
Your book is more useful.
It really is. And it's got pictures and it's got great stories. I like pictures.
The Senate inquiry did have 1 or 2 pictures, but it could have
I noticed that.
That's right.
It was the spiciest Senate inquiry I've seen, but yes.
Yeah. But I just think, you know, that most families know someone who has a child or an adult who has ADHD, and really successful, normal people who are achieving great things. And I think removing the stigma is an important role that people have to play, and you've certainly done that. And I think there's a lot to digest from this Senate report, and we should certainly take it seriously. It takes a long time to consider all of those recommendations.
OK. And if these discussions we've been having have raised any difficulties for you or anyone you know, the numbers for Lifeline and Kids Helpline are on the screen right now. Now, I'd like to bring in Marcus Veljak. Hi, Marcus.
Hello. Do you think that the crackdown of vaping will decrease the number of students that vape? Or do you think that it will only perpetuate more illegal avenues to purchase vapes?
Well, this is very much in your remit again, Mark, but I want to bring in a couple of other people first before we put the pressure on you. If I can be blunt. Di, how big an issue is this in your electorate? Is it coming up a lot? I mean, I know
it's not coming up. I spoke with a doctor today, and talking about vaping, and he said it's such a huge, a real big problem, and he said the vaping is that young people in particular, do it all the time, as opposed to, say, smoking. You can stop. Whereas vaping, apparently, the only time you stop, according to the doctor, is when you go to sleep. And it's so dangerous from his perspective that you can do it at work, you can just do it any time, and the chemicals that's in there that kill sort of that kind of that smoke, in order for people to vape as if they're not smoking, is really dangerous. So he thinks is a real big problem, and he's of a Middle Eastern background. He said it's a very huge problem within the community. I haven't come across many people who vape, but I hear a lot about it, not in my community. I think more of them smoke cigarettes than actually vape.
Wow.
Yeah.
In fact, I've heard of the number of people turning to cigarettes in order to quit vaping. The absolute opposite of what was promised, because you have to go outside. And it's a whole kerfuffle to smoke a cigarette.
So it's harder to smoke a cigarette,
but people, especially when you're working at home, people are just sitting there vaping all day.
All the time, yeah.
And so they've switch to cigarettes in order to quit vaping.
Okay, that's broken my brain. Jennifer, it really has. Obviously, there was a huge effort, and Australia did a very good job, I think, of trying to reduce smoking rates. Have we just got the next problem that we've now created for ourselves?
I mean, I speak more as a family member of someone who's switched from smoking to vaping, and it certainly hasn't decreased the nicotine intake that I've seen. I mean, it seems to be an incredibly addictive substance. And I was talking to a colleague today who was talking about his very young child, I think about 11 years old, who is asking Dad about, what would you think if I tried vaping? I mean, this is something that's really... 11, really very young age where kids have access to this. And the fact that it tastes like a candy, smells like a candy, tastes great is incredibly dangerous. And I know my naive little 9-year-old boy would pick that up just as well as he would a lolly. So yeah, it's concerning.
Now, Mark Butler, you have announced a crackdown and a different regime.
Yep.
It's been several months. We don't really have a timeline. When are we going to get the timeline? And what are you going to do about all the illegal vapes coming into the country in the black market? Because that's where lots of young people are accessing.
And that's really the problem. The border has been completely open, so they've been flooding in. We will put in place a regulation before the end of this year. We've been working very hard with states on putting together a single piece of legislation that will cover the field in terms of implementing our vape regulations. We were thinking we might have to pass legislation through every parliament in the country, which have been very difficult. So we're aiming to get that regulation in by the end of the year and shut the border.
Be able to do it just at the federal level?
Yes, and shut the border. Yes,
what does that look like? What do you mean? How do you shut the border?
We'll prohibit the import of vapes. Okay. At the moment, they're completely open. And this idea that we were sold, all communities all around the world, that this was some benevolent therapeutic good to help hardened smokers kick the habit, most of them middle-aged and older, is utter bunkum. You know, have a look at these things. They're made to look like highlighter pens so that kids can store them in their pencil case. They have pink unicorns on them. They are bubblegum flavoured. The stores that sell them are deliberately being set up down the road from schools like the ones that the kids in the audience go to. I mean, this is a cynical, deliberate tactic on the part of big tobacco to recruit a new generation to nicotine.
Okay.
And it's working. That's the tragic thing. It's working.
Drugs are illegal too.
The only cohort in the community where smoking rates are going up is young people. And it's because they are 3 times more likely to take up cigarettes if they've vaped. And pretty much the only people vaping in the community is young people. You know, our generation, they're not vaping. No. It's high school kids are vaping. Very young adults are vaping. Increasingly, primary school kids are vaping. That's why school communities tell us now the number one behavioural issue they have now in their schools is vaping. And I am utterly determined to stamp it out. This is a public health menace. You need to stamp it out.
OK, you make it illegal. Right now, cocaine's illegal.
You can't buy cocaine at a store that's deliberately set up down the road from this school.
But people are accessing illegal drugs.
Well,
the point is policing. So what are you going to do about the policing part of the story?
So I've said, and I'm seeing Border Force tomorrow to have a look at some vapes that have been seized. At the border, we have significant resources for Border Force and the TGA to stop these things coming in the first place. But we don't pretend there's not going to still be the availability of these things on the ground, which is why we're going to have to work with states. Health ministers and police ministers are meeting together. Don't remember the last time that happened, but we're meeting together later this month to ensure that there's policing on the ground of these things as well. We are concerned that there is going to have to be the involvement of police because organised crime has got very deep into this. They recognise this as a very lucrative, informal market. And because it was basically open slather for too many years, it has become a very big problem that's going to be hard to get rid of.
You regulate it in the same way that other OECD countries do?
No, they don't. They don't. And what you'll see is since I made the announcement I made in May, you're seeing country after country say that they're going to take the same approach that we have in Australia announced. You've seen France do it, you've seen UK start to shift to it, even though several months ago they wanted to regulate it. There's a bit of a talk, mainly sponsored by the tobacco industry, frankly, in this country, that it's all gone too far. We should just raise the white flag and accept that vaping is now a part of the Australian way of life.
They're arguing it should be regulated and you should that way you'll deal with the black market.
So all those stores that are set up down the road from schools, that's all fine. Like, this is utter rubbish. This is a cynical attempt to recruit young people to nicotine.
But it would be illegal for young people to buy it in a regulated way.
It's illegal now.
But
it's illegal
they're getting
now,
it
and they do
illegally. That's the
because
point.
they're coming in, they're flooding in the borders. We've got to stop them coming
Okay.
into the country
Matilda?
in the first place.
You mentioned it is illegal now. I can think of two different places that sell vapes on the same block as a police station. It's clearly not that illegal. Like, it is, but...
Illegal for kids.
Yes, but
kids are finding it easy to access them.
They're finding it very easy to access them because they've flooded, because there was this false distinction between nicotine and non-nicotine vapes, that non-nicotine vapes could come into the country and be distributed very widely in the community, but every time we test these non-nicotine vapes, they're filled with nicotine. Not to mention 200 chemicals, including things we use for nail polish remover, to de-ice runways, for weed killer. The 200 chemicals in and of themselves are causing harm.
The question was about whether what evidence we have that this ban is actually going to crack down on that. The vapes we're not meant to be having these disposable vapes constantly. We clearly do. Why will this be different?
No, the problem is we are. The border is open. The problem is Greg Hunt tried to put the import control regulation I'm proposing to put in. To his credit, my predecessor, Greg Hunt, tried to put that in. He was rolled by the Coalition Party room when they were in government within 10 days. And so the regulation was taken off. The border has been open since, and there are hundreds and hundreds and hundreds of thousands
How many extra
of these
police are you
things.
going to put on this? Because the actual policing is going to have to be huge if there is this level of a black market that's so embedded.
Well, the problem is that it's not a black market, it's an informal market. These are being sold in vape stores as non-nicotine vapes with nicotine in them, which is why we've said we've just got to get rid of the whole lot. You know, we've got to get rid of disposable vapes, which are an environmental disaster as much as a health disaster. We've just got to get rid of the whole lot. And the only vapes that will be able to be sold in Australia will be pharmaceutical-style packaging. They'll be sold in pharmacies only on prescription.
But doctors aren't prescribing them very much, are they?
No, we'll have to consider broadening the way in which you can get access to a script. But
because that's another critique of the current system.
Yeah, we're going to have to deal with that. But to the extent they are a genuine therapeutic good to help hardened smokers kick the habit, not a recreational product for kids, then we'll have to continue to allow that.
All right, Marcus, I want to bring you back in. Not a vapor yourself, right?
No, not myself.
Just to clarify, no vaping in here, let me tell you. No. But what have you observed?
Well, I think at school it's very multifaceted. I don't think there's one specific reason as to why everyone's vaping. I guess, as mentioned before, the marketing of the vapes, it's colourful. It seems like it's almost like a kid's toy, like a lolly, or it doesn't like have the same impact on young people that, let's say, cigarettes do. I think that's one of the main issues for young people. And young people are told, especially at school, about the risks of vaping. But I think especially it's become such a social thing as well. Like all your friends vape and the school tells you not to. And so people, I think there's so many reasons, like the social and also like the marketing like reasons behind it as to why young people fall into vaping.
So is it hard to say no to vaping then?
I think in comparison to cigarettes, yes. I think young people in particular, they see it more as a social thing. If all your friends vape, then to them it's almost like a social expectation that either you fit in or you don't. And I think a lot of young people in particular have that fear of just not fitting in.
Wow.
Year 12, schools are reporting Year 12 doing exams right now are having to put nicotine patches on to get through an exam because they're not able to vape for 3 hours. This is where we've got...
Keith, do you support the changes?
I think enforcement is the key, and it's not just vaping, it's also illegal tobacco. We've seen an enormous spike in the last 18 months of illegal tobacco. I was quite shocked in my own electorate to see illegal tobacco and illegal vapes being sold across the counter. And we've seen sophisticated criminal networks get involved in this, where there's an earn or burn, where there's a threat to sell it, and if you don't, we'll burn your store down. And there's often vulnerable migrant communities who are being asked to sell these. And it has to be about enforcement, and it can't just be left to local councils to try and patrol this, because it's just not good enough.
Yeah. I think we're talking all about enforcement and cracking down on the border and all of this. And this is going to sound like a joke, but I'm genuinely serious. Is there discussion about culturally, like vaping, the best thing we have at the moment is that it's really uncool? Like, it's not what the cigarettes have, that branding. Like, are we thinking about cultural aspects of this to ensure that we're not having influencers normalise it, you know, speaking to social media about, you know, the amount of people with just a vape in their hands. They're not smoking it, so it's not necessarily getting picked up by the, you know, moderation, the AI. Like, genuinely, the damage of, like, every cool villain in a movie smoking a cigarette has been immeasurable. Is there any thought going towards the, I guess, a soft power approach to vaping when it comes to it?
Love that, soft power approach to vaping. Have you thought about it?
We have thought about it, and some of the legislation we have in place is seeking to bring some of those controls, which include social media controls on tobacco advertising effectively, to vapes as well. That is a legal loophole that we're seeking to address in the Parliament.
Please.
Can I just add, I mean, I think it's really important in any public health intervention, and working in 70 countries around the world doing mostly public health interventions, it has to be a wraparound effect. So you have to have the social influence, you have to have the legality, you have to have the treatment, you have to have the counselling. And so this is an excellent tool. I'm pleased that my children won't be able to have access at such an early age to vapes, but it really has to be a holistic treatment approach from a medical perspective when you've got people with such heavy addictions.
And could we be, I mean, as you say, work in 70 countries, could we be coming in too late to this?
No,
Given it's so widespread among young people now.
I mean, I think looking at the success that Australia has had with tobacco, I think there is an opportunity, you know, to actually take a really holistic approach. I think that there are some really excellent public health wins that this country has had, and I think when you look at it from 360 degree, it is possible. But you know, I'm an NGO person and idealist at heart, so.
Let's go to our next question now. Alexandra Robbins.
With the festival season beginning in Australia and already the unfortunate deaths of 2 young people from suspected drug overdoses, why has the New South Wales government ruled out a pill testing trial? Does the government genuinely care about the health and safety of young people, or do they want us to learn our lesson by dying?
Di, I'm going to start with you because zipping around, uncertain, you're the only New South Wales MP in the federal parliament, so you don't represent the New South Wales government, but pill testing, should it happen?
Look, I think from my perspective, I mean, it's a state issue, but I think that if young people go out into festivals, I mean, we've spoken about getting pill tested before. You know, maybe they should. And maybe the young people have to also be informed when you go out that there's going to be so many, you know, people kind of passing you pills, and how do you control yourself and not get pulled into it or get being influenced by your peers to say, test this out. So it's also an individual responsibility. But I think, yes, government has to play a role in ensuring that it's a safe environment for young people when they go out, to make sure that, you know, you walk in there and you can enjoy it and not, you know, not be confronted by people pushing pills at you.
What do you think? It's obviously an idea which is always contentious, but there is some evidence that it can save lives.
I mean, I think harm reduction is the first step in any drug program that you're looking at. And it's harm reduction, it's taking away stigma, it is about providing people with help-seeking opportunities, awareness campaigns, treatment. And so again, you're talking about a whole wraparound. And I think that any tool that we can use to prevent a death, so you can get those other messages to kids or to people who are on the path to addiction or well into addiction, is a good thing to be doing.
Matilda.
I mean, like, I feel like, you know, prohibition clearly has worked for the past 70 years. If we give it like another 2 or 3, I reckon we'll crack it. No, I mean, very clearly people are going to take pills at festivals. Like, unfortunately...
Well, they continue to.
They historically have proven they're quite stuck on the idea. So it would be great for people to not die. Like, it genuinely... We're talking about in the ACT, we're talking about decriminalising personal size amounts of... Or not decriminalising, but not reducing...
criminal sentences.
Those words. And yet, it's, you know, a couple of kilometres away in New South Wales, we're saying, oh, we can't even test to make sure it's not filled with horrific toxins or things that are much more extreme or extremely dangerous drugs. I think, you know, if we were going to stop people taking pills at festivals, we would have done it by now. But what we can do is stop people dying from those pills, and I think that has to be the highest priority.
Yeah, it's contentious, Mark Butler, but what does the science tell you?
Well, this has been done in countries around the world now for a few decades, and it's generally got pretty good results. The ACT has started it here in Australia. They've been doing it for a few years. Their results show that about 10% of usually young people who have their pill tested and find out it's not what they were sold, discard it, so don't take anything. So that's a pretty good result. It also shows that they've picked up some stuff that is really dangerous, including like could have killed people if they'd taken it. So that's a very good result. It's all about recognising that at the end of the day, you know, kids are going to do this. As Matilda said, just say no does not work. We've had a harm reduction centred policy of around drugs now for almost 40 years, since the landmark drug summit in 1984, and I think we've got a pretty good balance here in Australia. So the ACT's been doing this for a few years, good results. I mean, the testing is partnered with a health intervention, so there's a discussion with the young person about you know, taking drugs and the harms and keeping yourself safe and hydrated and all the rest. So there's pretty good evaluation there. Queensland has said they're going to initiate pill testing. They haven't yet, I don't think, but they've indicated they're going to follow the results of the ACT trials. This is not a matter the Commonwealth is involved in. I mean, obviously, we want to make sure as far as possible that states are undertaking programs here that is consistent with the national drugs policy that we're all signed up to. But ultimately, I don't know what New South Wales is doing. I haven't heard that. It's a relatively new government. But there is a live discussion now, I think, as a result of the ACT trials right around the country. Queensland has said that it's next off the starters mark, if you like, and we'll see how that goes.
But with El Nino coming up, we know that heat increases risks when it comes to drug taking. Do we have time for a lively discussion, or does more direct and immediate action need to happen before the 35-degree days come?
Well, look, ultimately states are responsible for these public health measures.
But you broadly
and
think it's a good idea?
Well, look, I think there is evidence for it. Ultimately, those states are going to have to take these decisions. They're answerable to their people and their voters about this. They have the policing advice and the public health advice. They've got the resources to deploy these things. I'm not going to second guess them, but there is a bit of evidence in Australia now, as well as the international evidence, about what happens when you do it. But I'm not going to pretend it's not uncontroversial.
It's very controversial, clearly. Keith, you heard the question about saving lives. You can't stop young people doing these things necessarily, so should it not be about trying to save their lives?
You can save lives, but there's many different ways to do that. There's actually 3 limbs to our national drug strategy. There is harm reduction, but there's also demand and supply reduction. If you focus solely on harm reduction, you necessarily have to pull back on demand and supply reduction. Just how can you allow this to happen at a festival, but at the same time have police enforcement of whether people are carrying it or not? So you have to pull back on the other 2 limbs. And the other 2 limbs have been a key part of our national drug strategy. The Labor government in New South Wales have said they won't. The opposition, I think, is in lockstep with them. And that's probably for good reasons. They're risk averse and they have a border with the ACT. So it's been, I think, since July last year, the ACT has been undertaking this experiment. It's extended to the end of next year. I think the evidence should guide the decision, but I think they should look closely.
Isn't the evidence showing that it's working? I mean, I've interviewed on RM Breakfast a couple of times the people behind the pill testing place, and there
is some evidence.
Incredible work they do. They find new wacky stuff that they are able to warn about. I mean, they are actually able to put out public warnings saying, we've never seen this before, we're worried about it. It can play a really important role, can't it?
Of course, and this is all complex, but when you do that, you are also incentivising more people to do it, which increases risk through exposure.
You might be making it less cool, actually.
Maybe, and we'll find out. So
if authority is involved,
look closely at the ACT. That would be my advice to the New South Wales. I don't think New South Wales needs to undertake another experiment.
But you don't believe in closing... You do think that we should wait and see what the evidence shows.
I mean, I would rather a world there was no drugs and no safe amount. Of course I would.
I would prefer a lot of things too, but the world we live in...
Of course. I think Australia has got the balance right. If anyone has been to the United States in the last year, the fentanyl spread throughout that country is horrific. Touch wood, it hasn't come here yet. I'm worried that the ability to test new drugs is something that we're not going to be able to keep up with. And that's some of the evidence we've shown, that not every drug is capable of an instant test. Some of them take many days in a lab. I'm not a chemist, but some drugs are easier than others.
Well, let me just check. How many dance parties are you going to this summer?
0.
None, not even one.
Mark Butler?
I'm pretty confident 0.
Oh, come on. You're wild. Di?
0, sorry.
All right, well, it's only me then. Thank you so much. And we can bring you the result of our online poll now. We asked you, should alcohol have graphic warning labels similar to cigarettes? More than 8,200 of you responded. Here's how you voted. 56% of you said yes. 37% said no, 7% were unsure. That's all we have time for on this program with our fantastic panel. I want to thank them, Matilda Boseley, Mark Butler, Jennifer Tierney, Keith Wolahan and Di Lee.
Thank you.
Thank you for sharing your stories and your questions. Next week, I'll be with you live from Melbourne. Joining the panel, Assistant Minister for Foreign Affairs Tim Watts, United Nations Special Rapporteur Francesca Albanese, former Australian Ambassador to Israel Dave Sharma, Australian Palestine Advocacy Network President Nasser Mashni and Chair of the Australia, Israel and Jewish Affairs Council Mark Liebler. Head to our website to register to be in the audience and I think you can probably tell what the topic is. Good night.